food is so vitally important to our mental well-being, and what I feel we are missing is that food actually impacts our mental health, and the emerging science of the gut-brain connection, the gut microbiome over the last 2 decades especially, has helped bring that forward.
Why does the food that we eat have such a big impact on our mental health?
Not only is that a great question, I think it's one that many people and many of us have actually missed for quite some time. We've made these connections to physical health. I think you and I have talked about that before as well. You know, we've been worried about a lot of the books out there on self-care and self-help around weight loss. And medically, people are concerned about hypertension and type 2 diabetes and obesity in relation to that. But no one has actually factored in mental health. And one of the things that COVID did is it uncovered the mental health crisis, which was always there.
Right.
And what it also taught us is how our metabolic health and our poor is the number of diseases we already have made us susceptible to severe infections, even death, during the acute phase of COVID. Again, I think with uncapping that whole area of mental health and how distressed people were, it also made that link to how we were eating. So I'll start there because I think for many years we've just not made that connection.
Yeah.
But food is so vitally important to our mental well-being. It's not the only thing. I still do prescribe medications and sometimes it's life-saving for my patients, but it's not the only solution. And what I feel we are missing is that food actually impacts our mental health, and the emerging science of the gut-brain connection, the gut microbiome over the last 2 decades especially, has helped bring that forward. So that's a very long answer to say how we eat impacts how we feel, but we often don't make that connection. Part of it with not really realizing that these 2 organs are connected. And I think the more we pay attention, I think there's a way to help alleviate our mental health through, like I like to say, the power's at the end of our fork.
Yes, yeah. I'm so glad that you immediately brought that up, the connection with our mental health and physical health.
Yeah.
Unfortunately, in medicine, those 2 things have become compartmentalized and separate.
Right.
When in reality, like a very strong, tangible reality is that you can't separate the 2. They're existing in the same person.
They exist in the same person, and it used to be that, you know, with mental health, it was always, you know, from the neck up. We know so much more now, but also why haven't we connected the fact that if someone is having and struggling with their physical health, there may also be a mental health component, yet we know that individuals with depression, anxiety, and other conditions often have comorbid medical conditions. We haven't put those things together. You know, we cite the research, we know they exist together, but we don't think, why can we make that connection around nutrition, food, eating healthier, and bringing in lifestyle measures? Yeah. You know, in the hospital, there are sort of check boxes to asking people questions, but it's not a real part of our evaluation, and it's a huge gap.
Yeah. And I love that you're stepping into this role in such a powerful way. You know, you've pioneered nutritional psychiatry. Can you talk about what that is and why it's so valuable?
So thank you for saying that it's valuable. I feel much the same. Nutrition is key to mental health, but I've brought this forward because I've seen this in my clinical practice. And now it's followed by no longer any soft science. There are actually real research studies behind it. We still always need to do more research. We always are humble. I think you and I are very, very aligned on that. We're always humble about whatever new research is coming out. We are willing to discuss it, willing to look at the pros and cons, but also willing to look at the data. But nutritional psychiatry is the use of healthy whole foods and nutrients to improve your mental well-being based on the scientific evidence. And it does not exclude therapy or medications, both of which are hugely important. And I felt that we were prescribing medications in psychiatry, and we know that some of the most serious side effects are both metabolic and weight gain. Connected, but also we know that while you might improve depression or reduce psychosis or help a mood disorder like bipolar disorder, they also cause these side effects. Yet we weren't, other than testing labs and stuff like that, which is important, we were not really looking at lifestyle, not really getting under under this problem. And I feel like that gap needed to be filled by making it a more comprehensive, integrated, and holistic approach to mental health. Whereas I feel the way we practice in the hospital is defensive. You come in with symptoms, and I pull out a prescription pad, and there's a medication. That's how psychiatry functions for the most part. And I think we need to re-examine that.
Yeah, I think so as well. You know, you said this already. You had that caveat. Our wide range of medications that we now have available have their place, absolutely. But unfortunately, it tends to spot treat or target a certain symptom.
Yeah.
Whereas if you really look at the value of food, it has a whole system impact that's generally very positive if done correctly, and no side effects, versus this symptom-based treatment that does impact our entire physiology, but tends to come along with a wide range of negative side effects as well. And so I think it's getting to the place where we understand that food, just like that medication, it's really about altering our biochemistry. Every bite of food that we eat,
Yes.
you know, nutrigenomics, nutrigenetics changes our genetic expression.
It
It's
does.
so powerful. And I love that you mentioned it once being a soft science, because, you know, when I first went to college, it was optional on a pre-med track to take nutritional science.
Yes. Yeah.
Right? And it just was kind of like, you know, it wasn't a big deal.
Right.
And even,
Correct.
but it was also very cookie cutter what was being taught at
Yeah.
the time. And we've
Yeah.
progressed so much in recent years.
We've progressed a lot, Shawn, and forgive me if I mentioned it the last time we chatted, but you know, it's still about 1 in 5 medical schools in the United States actually teach doctors nutrition. Some schools are doing better than others, but the last time I looked at the data, it still wasn't across the board. Then doctors actually expected to have these conversations, so that in itself is a gap. So I feel integrating that and placing practitioners of all kinds in the role of understanding nutrition, understanding how to interpret it to people, becomes powerful, because then in addition to, say, someone needs an antihypertensive medication, maybe having them take it but also follow lifestyle measures can be very powerful, right? Because you've got to control the blood pressure, but there are other things they can be doing, and I think that gap needs to be filled. And I can't say that psychiatrists are practicing this way, and I don't blame them, because it's not what we've been trained or taught. What we've been trained on and how we are taught to think is using DSM-5-TR, which is a checkbox system, and it's difficult because people don't fall into checkboxes. Human beings may have a little bit of depression and some trauma, you know, problems with focus and anxiety. They don't just fall into one category. And that's another thing that emerged during COVID, that it's always been there, but it became more obvious that people were suffering in different ways. So much so with insomnia being called coronasomnia, because sleep has just suffered so much. And I think that trying to integrate a more holistic and integrated way to think about it, patient care, you know, like you mentioned, physical health and mental health, but also just the whole body approach. And how can we think about it? How can we think about gut health? How can we help people feel better? And inadvertently, many of my clients actually lose weight because they're just eating healthier and adopting a healthier lifestyle. But it's not the goal. And I think there's a difference there.
Yeah, absolutely. You know, I think it was such a eye-opening statistic to think that 1 in 5 medical schools are really integrating nutrition, any type of training, really, because, you know, a friend of mine, Dr. Will Bosowitz,
Yes.
you know, Will, he shared, of course, like 12 years of school and had maybe the accumulation of a couple of months of education in nutrition. And he specializes in organs that deal with the assimilation, digestion, and elimination of food.
Yes.
And yet he learned so little about food. But to expand that awareness, to understand that when we take on that mantle of wanting to be of service and to work in medicine, which, as you know, most folks are getting into the field to be of service and to save lives, missing this key gap, it might be the biggest domino, because it's understanding, as a cardiologist, for example, and you're treating your patient's heart and their cardiovascular system, that heart itself is made from food, right?
Yeah.
Their blood is made from the food that they've eaten, or the lack thereof, the hydration, all these different things. And so, again, we're kind of window shopping here. We're not really understanding what we're actually looking at. And so that's what this movement really is like, and even this 1 in 5 has changed, because it was probably 1 in 10 not that long ago. And it's starting to, and thankful to mediums like this and other opportunities, that a lot of physicians are tuning in and learning off the record, off the books, and being empowered. And you're one of those people, because like you said, you weren't trained in this particular way of thinking, and you had to have the audacity to ask different questions and to start to push things into culture. And you created this entire, really this field of study with nutritional psychiatry, and also having a certain wing in a very prestigious institution where you're treating patients more holistically.
Correct. And, I have to acknowledge that came with support from the fact that if the people around you, they may not be practicing the way that you're practicing, but if they don't support and give you the opportunity to express that and bring that forward, it couldn't happen. And I think that, some of my mentors actually did some of the earlier studies on folate and methylfolate back in the 90s. And it seems like so long ago, but actually it's not. Yet they were making these connections between low folate in the brain and low mood. So now that we know things like, leafy greens and just the salads that we can eat are not just the fiber, which is hugely important, and the other nutrients, but also the folate. So putting these things together has taken time. And there's still more to be done. We are still very early in this area, but I think the food as medicine component of all of this is so important, because now every single major chronic illness is associated with nutrition, and is one of the major driving factors that can be changed. Yet I think it's 2 in 10 Americans eat enough servings of fruit and vegetables in their diet, and we know that. Yet I think we spend a lot of time counting protein, which is important, but it's often fiber and those other nutrients that we're missing.
Yeah. So you said something so profound earlier about, the system that, it has its place in a certain level of efficacy, which is this kind of checkbox system.
Yeah.
However, the marketing towards several different medications involved in psychiatry are for, quote, chemical imbalance.
Yes.
Right? So can you talk about the conflict there?
Yeah.
And how do we get into this place where we have something, this kind of blanket statement like, oh, you have a chemical imbalance.
Right.
And also the new data coming out about the serotonin deficiency theory.
Right. So new research this year by a group in London has actually uncovered the fact that perhaps we've been basing this so-called chemical imbalance. I actually don't like the term. I'm sure I've used it many times. But again, goes back to how we've been educated in the field of mental health. But really looked at the fact that maybe there isn't a real basis to this. And I think that for the part of me that is still a clinician and deals with patients, I have to be very cautious about not just saying to people, come off your medication, do this and do that. Let's do this carefully, cautiously. But what I think it pointed to is we need more research and more of an understanding as to how we got to this place. Yet, I think the power in this, and what it taught me more, Shawn, was there have been some recent revelations this year about some falsified information with Alzheimer's that's still being looked at, and theories that we've believed and followed and understood and researched for decades now. Then the serotonin piece. And it's really gotten me thinking about the power of nutrition more.
Yeah.
Because here's the thing, you can have a side effect from a medication, you may not do well on a medication. We know that studies of, say, anxiety, not everyone is cured when they take an anxiety medication. Many people continue suffering. But if you are willing to be patient with yourself, maybe make some healthy adjustments in your diet, look at how you're eating. Nutrition can be a really powerful tool, because you said earlier, you're not going to get a side effect unless you have an allergen intolerance. You're not going to get a side effect from food. And when we look at all these theories maybe being uncovered, changed, evolved, and more research coming out, food becomes a natural tool that we can turn to, because we're not sure whether Prozac works anymore, and is that actually how it's supposed to work? And it's never been how I've seen it, even though I've been taught that way. I'm not saying that I have a solution or that I know everything. What I'm saying is, when I sit with individuals and I have this checkbox system, I always feel a little bit out of depth, because I feel like there's a human being sitting in front of me who's telling me how they're feeling. They don't fit into all these checkboxes. I don't think it's necessarily an imbalance. And I feel those words don't fully describe, even in the brain, what's going on. So if anything, we just need more. We need to do more and learn more and embrace change in how we're doing things.
Yeah, I love that. It's so powerful, because when you say that it's a person sitting in front of you, if we can expand our awareness of the fact that just something simple, every two people, their depression is not the same, right?
That correct.
Two different people, 100 different people, it's 100 different versions of anxiety, or depression.
Correct.
Yeah. So what we tend to do, again, is we want to compartmentalize things. We want to place labels, so we can have standard of care.
Standard of care, and with standard of care comes medication care, because hospitals are all about, how we standardize these formulas for treatment, these protocols. And look, for example, stroke protocol, hugely important to save lives. Myocardial infarct, hugely important. Mental health, a little bit different. We have in the hospitals ways that we can contain and manage an emergency, and all of those are extremely important. But let's think about this for a moment. We need to be looking deeper at the human being, the human condition, and trying to understand that better. There's so many different ways that anxiety can present, and sometimes you are treating a completely different symptom. And I've found in my patient care that sometimes people are coming in for one symptom, but when we work on gut healing through their diet, we realized that was being driven. The anxiety was being driven by just probably dysbiosis, some underlying inflammation going on, and the symptoms of anxiety subside. And we've been able to avoid medications in instances where people can work in a slow and steady way and sort of tolerate those dietary changes and tolerate the symptoms.
Awesome. This is a perfect segue, because, and we'll put the study up for everybody to see. This was a study that you were talking about a little bit earlier. The title of the study is The Serotonin Theory of Depression, a Systematic Umbrella Review of the Evidence. And this was published in Molecular Psychiatry. When you just mentioned dysbiosis being a potential component in a variety of mental health issues, why? And if we look at where is serotonin even being produced or stored in the body, a lot of that activity is happening in the gut.
In the gut
itself. Correct. So maybe, again, not looking at this being some kind of deficiency or quote chemical imbalance that we aren't really checking for, but are the systems that are producing and managing these things actually healthy, so that we're not trying to treat a symptom?
I love that. The dysbiosis comes from that remark I made a few minutes ago about the gut and brain being connected, and we don't think about it that way. So we break that down for a second. The gut and brain originate from the exact same cells in the human embryo, the neural crest cells. And when they divide up, they form these two organs, and they remain connected by the vagus nerve, which is like a two-way text messaging system, always communicating all the time. But then 90 to 95% of serotonin receptors and serotonin, as well as other neurotransmitters, are produced in the gut, which is why when you prescribe or have a family member or friend or someone has had one of the SSRIs like Zoloft, Prozac, or Paxil, any one of them, the first couple of weeks they actually might have gastrointestinal distress or discomfort because it's a very common side effect of these medications. Usually in most people it subsides, but other people, they can't tolerate it and we have to switch or change the medication. But that's also, now we understand, it's related to where the receptors are. When you look at that environment of the gut and there's inflammation, one of the ways inflammation gets set up is through how we're eating. So if we say consuming a fast food diet, and lots of processed, ultra-processed foods, a lot of added sugars, a lot of artificial sweeteners, those types of foods, the environment of the gut flips because there are trillions of microbes, but there are also, it's what we feed the microbes. If we're feeding them fiber through a plant-rich diet and other good sources of food, or we're feeding them a fast food diet, when you feed them fast foods, the bad bugs thrive. And when they thrive, their breakdown products are more toxic to the gut environment. And when those toxic, two things happen. So, well, a few things happen. But one is the imbalance happens, called dysbiosis. But also the toxic breakdown products start to damage the single cell lining of the gut. And those tight junctions start to move apart because these toxic substances are damaging them. And then leakage happens. So this is how the term leaky gut or intestinal permeability comes about. And, I think that all of a large component of the serotonin, the receptors, all of these things are interacting in this gut environment with the gut microbes. So dysbiosis to me clinically makes a lot of sense when I see people start to feel better as we improve their gut health. And as they're eating healthier, which is helping lower that inflammation, maybe improve that imbalance or dysbiosis.
You just brought up something so powerful we haven't really talked about before, which is we have the experience of us eating.
Yeah.
Right? We eat the fast food, right? We eat the Big Mac, but our bacteria are eating as well.
Yes.
Right?
We're feeding them.
We're feeding them,
yes.
and they're getting their munch on and their metabolic breakdown products because we're taking something that's very artificial,
yeah.
Right? If we talk about, for example, a ding dong. Do you know what a ding dong is?
Yes, I
do. We're taking a Hostess ding dong, which is something that is completely abnormal. There's nothing natural or real about it. And we're feeding this to an already dysbiotic gut, we'll just say.
Mm-hmm.
So we have this higher prevalence of more pathogenic bacteria. Now they're munching on this stuff that's never existed before in human history. The interesting thing about humans is that our bodies are so resilient, it's trying to sort us out and protect us. And so they're still trying to break this stuff down.
Yeah.
But the metabolic waste, the byproducts of this,
yes.
This brings about the situation of endotoxemia.
Yes.
Right? So, wow, this is like, it's not just us eating, it's our bacteria eating.
It's feeding them. And I like to say, Shawn, a happy gut is a happy mood. Because if you are taking care of those little gut microbes and you're treating them, not only is they a part of your body, but part of what you need to take care of. If we're exercising, we're doing certain, say, stretching exercises to make sure that our bodies stay in balance. Well, in a similar way, when we're eating, we're also feeding those microbes. They are part of us, just like we take care of our muscle aches or anything like that. We are almost not thinking about them that way. And the biggest way in which we forget this is how we eat. Yeah. Because those lapses, I like to remind people it's not about the food on your plate today or the number on your scale tomorrow. It's this is a marathon and not a sprint. So it's over time. On your birthday, have a piece of cake. If that's what you want, have the piece of cake. But that's not should not be your consistent everyday diet. That's all I'm saying about it. Because the other thing we tend to get into, one of my pet peeves, is these food wars and diet dilemmas. And then people end up really miserable around food because they're not sure what they can eat and what they can't. But if you have just general guiding principles around healthy eating while connecting the effects of the foods to especially brain health, which is the part I care about, but also physical health, that is much more powerful for a person. So understanding that, the occasional ding dong, maybe that's what you wanted on your birthday, I'm not sure. But, but that shouldn't be your consistent diet, because then what you're doing is you're feeding your microbes and you're not taking care of them. And what you can do is lean into those plant-rich foods, because that's where you get your fiber. And fiber is what feeds the microbes.
Yeah. Wow. So it's something very simple. It's making it the exception and not the rule.
Yeah.
Right? When we're having these call it what it is, food-like products.
Food-like products, yeah.
With that said, however, the current state here in the United States right now, about 60% of the average American's diet is made of these ultra-processed foods.
Correct.
So it is not the exception. It is the rule for people right now. And of course, there are a lot of social issues and structures in place that enable something like that to manifest.
Yeah.
And then we look at this kind of vicious circle that we get into, where we're in this state of consuming food-like products and the skyrocketing rates of every condition we can talk about, whether it's a physical chronic disease or mental health issues, everything is up. So clearly something is awry, something is broken here. And addressing it at its core, it starts with really education and empowerment and directing people towards these powerful insights. So I want to ask you about this, because you mentioned gut inflammation, and you shared a couple of studies recently that were really mind-blowing, and it's looking at the role of omega fatty acids, omega-3s and omega-6s in psychiatric disorders.
Yes.
Let's talk about that a little bit.
So there was this really great study published recently looking at the difference between a diet that was rich in omega-3s versus omega-6s. And here's the thing. We want the balance of those two fatty acids to go in the direction of omega-3s. But if you are consuming a lot of those processed, ultra-processed foods that we just spoke about, so a large percentage of us are in this country, which is why it's called the standard American diet or the SAD diet. Unfortunately, those the omega-6s drive inflammation. They're pro-inflammatory to the gut and to our bodies. And it was found that basically symptoms of bipolar disorder were improved if the diet was richer in omega-3s. So the overarching message from that was eating those healthier omega-3 fats and cutting back. My interpretation is certainly cutting back on the omega-6 fats and those processed, ultra-processed foods that are going to cause more dysbiosis in your body.
Perfectly said. When we hear the term processed food, like, what are some of the constructs? Like, for example, it's the oils that are used, right?
Correct.
To make them, quote, shelf stable.
Shelf stable. So that's a great point. So when we think about it, let's actually define processed and ultra-processed foods, because just like the client, I always remember the Shawn came in and said to me, people tell me that, avocados are healthy. I have no idea what to do with it. Tell me what I can do with an avocado, etc. So I don't always assume that someone knows what I'm saying when I say processed, ultra-processed foods. So it's hard for us in this country to avoid processed foods. But I think it's the type that we consume and trying to consume less of it. Always look at the food label. And when the ingredients you cannot pronounce and the ingredient list is a big rectangle, these are hints that this is a processed or an ultra-processed food, especially if you don't identify what's on the label. When it says cauliflower, that's different, right?
Yes,
Pick up a package of frozen cauliflower. What does it say on the back? Cauliflower. So it's that difference. The other thing people need to understand is there's a repository of over 250 other names for sugar on food labels in the United States.
Unbelievable.
And my favorite is brown rice syrup, because we make that association, or we've been told that maybe brown rice is healthier, and brown rice syrup is simply sugar. So understand that a processed, ultra-processed food has very little actual food in it, and ingredients like that maybe are ones you should be staying away from, but they also contain hydrogenated fats, the wrong types of fats, processed vegetable oils to make them more shelf stable, to make them last, to help the processing. They have food stabilizers, dye, colorants, all to make it last very long and be shelf stable. But none of these ingredients are good for our bodies, specifically not good for our gut because they're pro-inflammatory. And they are sources also for omega-6.
Yeah. Wow. If, again, we haven't really been exposed to things like this amount of omega-6 fatty acids in our diet.
Yeah.
Largely, you mentioned brown rice syrup, right?
Yeah,
So again,
yeah.
it sounds like it's a healthier syrup.
That's right.
The
It's
same
very
thing
tricky.
with
Yeah.
vegetable oil, right?
Yes.
They're using kind of health washing label to make something that is abnormal.
Marketing, yeah. The marketing of the food makes you as a consumer think, oh, my doctor told me I should eat more vegetables. This is a vegetable oil,
Boom.
right? But when you if you actually look at the label, many of those contain a very large percentage of soy, which is also a vegetable, but that's, very pro-inflammatory. So looking at labels is one of the things I try to teach my clients because it's not something we pay attention to as much. Another one is, we've talked about sugar before. People assume, well, they've heard me say, eat your blueberries, add them into your diet. But a fruited yogurt with blueberry, if you consume dairy, like a fruited yogurt, a small half-size cup can contain 24 to 26 grams of sugar. But our food labels are in grams, so we don't know how to interpret that because when we cook, any recipe book has pounds and ounces in it. That's how recipes are written. So most consumers go to the supermarket and they have no idea what number of grams means. So 4 grams of sugar is 1 teaspoon. So always divide that by 4, the amount of sugar, so that try to go for the plain yogurt and add your blueberries in versus even a fruit juice. Eat the orange, skip the fruit juice because that has the fiber removed and often has added sugar. And again, coming back to processing and ultra-processed foods, those are not the examples, but understand the food labels so you know how to make your selection.
Yeah. One of the things that people might do, and I know that I thought I was doing better for myself by not drinking soda, but instead having 100% orange juice, right? Pasteurized orange juice. 20 ounces of that is 14 teaspoons of sugar. 14 teaspoons of sugar.
And that's a great example, Shawn, because until I show my clients the food label and we break it down and we divide it by 4, you don't realize it. Now, if you had a regular glass in front of you, would you really be adding 14 teaspoons of sugar? So I think when we think about it and understand that we need to empower ourselves a little bit more, and actually help tell our doctors the same thing, have a conversation with your doctors about what else can I be doing, what lifestyle measures can I be taking along with this medication if I absolutely have to take it. I think those are just equally important now.
Yeah. And just as a point of reference too, I mentioned 14 teaspoons. 20 ounce soda, say Coca-Cola, is 16 teaspoons. Yes. So again, it's pretty close. And we can try to justify getting some vitamins and minerals with this. Sure, but that amount of sugar is so abnormal and it's coming along without the fiber.
It's coming along without the fiber. And I think that if you ate the orange, right, from the outer skin, which you can zest. I love to zest the skin onto a salad. That actually gives you some great nutrients because there's a lot of antioxidants in the skin of an orange. Then you peel it and eat the orange. You're getting the natural sugar from it, but you're not getting the 14 teaspoons. Plus, you're of course getting the fiber with all of that, and so critical to thinking about the whole food versus the processed version of it. Same thing with vegetable juices.
Yeah. I love that you brought up the distinction of ultra-processed foods, whole foods, and also there's minimally processed food, like olive oil has been used for thousands of years. Yeah. I encourage people to go to YouTube after you enjoy this wonderful video on YouTube. Go to YouTube and look up extra virgin olive oil making and see how it's literally cold pressing.
Yes, cold pressing the
olives, and that's how you get the olive oil. Versus look up how canola oil is made, and just marvel, like your jaw is probably going to be on your desk watching this to see the high heat temperature, the deodorizers used, and all of these processes that take this very unattractive thing that has now been, obviously these oils are sensitive too. That's another thing.
Yes.
Omega-3s and omega-6s are highly heat sensitive, and they're already wildly oxidized and damaged. And then they're bottled up in these plastic bottles, and they're said to be, this is a wonderful health food because it says vegetable oil on it.
Yeah. I completely agree with you. It's interesting because in This Is Your Brain on Food, I felt that non-GMO organic canola oil could be an option for individuals with mental health if not everyone has access to olive oil or to avocado oil, which is one of my favorites for cooking at high heat. But I've really reconsidered that now because of the videos of actually watching what's been done to it. And so I think that if I were, to write another book, I would talk a little bit more in depth about the research, additional research behind that, and the fact that, maybe that non-GMO canola oil is more affordable. That was my reasoning behind it, because of the psychosocial barriers that people with mental illness face and access and things like that. But I think I want to think a little bit more out of the box for better solutions. Because I agree with you. The level of processing is just doesn't work. Doesn't work for our bodies or our brain.
The best teachers, and you're one of those people, are eternal students. That's one of the things I admire about you, is questioning things and, adjusting our own perspective as we go along. Because for me, again, when I was trying to eat healthier, when I was in college and, I was going for organic, right? Or organic vegetable oil, right? Or organic margarine, right? So I was trying to upgrade what I was doing. And eventually it brought me just to a place of simplicity, right? And also, I always ask, like, what have humans been doing the longest? And one other part I left out, and by the way, if you happen to not go to YouTube and watch this, also the chemicals used just to kind of wash it, by the way, they're not just taking organic olives, they're taking these oftentimes genetically modified, and you just said it's another step up that we could say non-GMO, right? But to actually break this stuff down, and so they put in this giant vat and this wash with all these chemicals. It's nuts. I don't want to talk about it anymore. It's like it's like dirty talk, but not the good kind.
Right. I totally get it. And we live and learn, and we try to all up our game on recommendations, but also as the research comes out now, we know more.
Yeah. And so you shared this, and I had missed this. This just came out this year, 2022. The title of the study is The Relationship Between Linoleic Acid Intake and Psychological Disorders in Adults. And by the way, so that's omega-6 fatty acids that our diet, we'll just say somewhere in the earlier part of the 1900s. And this was from Dr. Kate Shanahan, who's like just such a brilliant mind when it comes to this stuff. She's obsessed with studying these oils. She shared that somewhere in the ballpark of about 2% of our fat cells were made of these polyunsaturated fats coming from, predominantly seed oils. And that was what was done when taking a biopsy of a human cell, a fat cell. And then today, that ratio of PUFAs, largely from these omega-6 rich seed oils, the makeup of a human fat cell now is somewhere in the ballpark of like 20 to 25%. It's literally changing the ingredients of what our cells are made of, So it's really fascinating, but it brings us back to this understanding of like, what are we making our tissues out of? What are we creating our signaling molecules out of that are determining how we feel, how we think, all the things. It really is made from food. So I want to ask you about this as well. When you mentioned brown rice syrup, I thought about our conversation that we had yesterday when we were hanging out, and we talked a little bit about rice and just how, coming from your culture in India and seeing white rice has been utilized for centuries. The same thing in Africa, my wife being from Kenya, white rice, other countries in Asia, China, Japan. And the question was, why white rice all this time? And I was sitting at a restaurant when I was, again, thinking I'm doing the best thing. And I'm seeing the restaurant owner at this Chinese food restaurant, and their kids were sitting in a kind of a corner booth. and they were eating white rice and vegetables, and I was just like, don't they know brown rice is so much better?
Right.
Right? With my like broken health and trying to figure my stuff out.
Right.
And so we were just kind of kicking around the question, like, why do you think our ancestors removed the germ, the bran
Yeah.
from the brown rice?
I think you had a better answer to that, and it was such a thought-provoking question. I feel like they must have figured something out because their bodies could tolerate it. No one was getting sick. They could cook it. It would last. Think about how food evolved. When do they have refrigeration? How do they cook these foods? How do they even harvest these foods? So I think there's huge value to what you're saying, because a very big white basmati rice is huge in India. So it's what many families eat. It's eaten all over India. I would say the south maybe slightly more than the north, which is more rich in the breads and the naans and the whole wheat grains and those flours and stuff like that. But it's eaten all over. So I have to give credit to the fact that they had figured out something in their wake and before we came along. I also feel that it brings up for me another thing in nutritional psychiatry, which is balance. A sense of balance, a sense of moderation about what we're eating. Because one of the things I am concerned about is that in the South Asian, East Asian population, there's a rising level of type 2 diabetes. So I have to wonder, ancestrally over all of these years, besides all the junk foods, more processed foods, more of the wrong types of oils like omega-6s, what have we done? So I can't blame it on rice, but I think we have to look at what the diet is that in other South and East Asians has caused this rise in these conditions. But I think it's something that, again, I think needs to be looked at, and we need to think more deeply about it. Maybe we eat it, but we eat less of it. Maybe we add in those extra vegetables. I always, by the way, find it fascinating in Chinese and other Asian restaurants, what the actual either the families there or the staff working there, what they eat versus what we eat when we go into a restaurant, into the same restaurant. They actually often eat a very, very vegetable heavy diet. I've seen them cleaning the vegetables, seen them eating the vegetables off ours. And, definitely rice is involved, and definitely different proteins and meats and all of that, but very vegetable heavy. That's the other thing compared to what I order if I might go to a Chinese restaurant. Very different. And I think that's also how food evolves across cultures, the Americanized versions of things too. So
absolutely, yeah. They were not eating the hot braised chicken that I was usually buying.
That we might be ordering. That's not actually what they're eating.
So, just going back, that's one of the things that you mentioned when we had the conversation about rice, which it sounds like we're just two total nerds. We're hanging out with each other and talking about rice, but you were also leaning towards like a rice heavy culture, possibly increasing the risk of, again, insulin resistance and rising rates of type 2 diabetes. There has to be balance here as well. It's not to villainize any food. And that's what I also love about your approach too, because you said something earlier, you said diet wars.
Yeah.
And so there are people who are kind of on the leading edge of a lot of stuff who are battling about minutia instead of really looking at all of our intersecting points and being more inclusive.
Definitely being more inclusive, because I think that Shawn, what brought me to this place is also looking at this through the lens of mental health. Again, what do people have access to? They already dealing with psychological issues. Let's put aside the chemical balance imbalance question, but let's just call it psychological. Their psychological health is suffering, and they have enough on their plate, literally and figuratively, to then now sort through, let's demonize this food group and that. There's also interesting science, which I know you'll be familiar with, around the formation of resistant starches. So, boiling or baking a potato, allowing it to cool, and then eating it later allows for the formation of resistant starch, and it makes it a healthier product and lowers the glycemic index. The same I've read about regarding rice. And I think that that could be one way. Certainly, there's a couple of studies regarding pasta. So I think that these are ways to tweak. I'm not saying it should be the center of your diet, but these are part of many people's diets. How can we actually educate, teach, think about studying ways to boil or, let's say, bake those potatoes, cool them, and then eat them? Don't eat a ton of them, eat them once in a while, because they will actually be part of most people's diets, rather than saying never ever look at, rice or pasta. I think that's hard for people. I just think it may not be what you eat or I eat or someone else, but it's a lot of what people eat. So we have to find better solutions.
Yeah, I love that. So you've obviously brought up early on in the conversation, this is so important. You mentioned that with the onset of COVID in our culture, it's really brought forth this conversation in a bigger way about mental health.
Yeah.
But you said, I believe you used the word exposed what was already happening,
Yeah.
right? This was a growing issue for the past few decades, seeing the rising rates of depression and anxiety and ADHD and schizophrenia, and the list goes on and on and on. Something is clearly not working.
Yeah.
And one of the issues, and we talked about this a little bit in the elevator, is PTSD.
Yeah.
And it's such a complex thing to talk about
Yeah.
in the first place. But even in the context of COVID, there is a lingering post-traumatic stress
Yes.
obviously occurring in our population
Yes.
from this. So let's talk about this, because this is one of the chapters in your book you specifically target and talk about the topic of PTSD, because of course this is something you've seen in your work.
Yeah.
But let's talk about the landscape of things right now and something we can do to start to address this.
Yeah. So food can always be a component, but let's look at the larger picture of just PTSD, trauma, and stress that's been going on. We know that some of what underlies this, besides the traumatic event, what's happened, is also how we're eating and inflammation. So inflammation is definitely a portion of this. But I think that one of the things that not everyone may have realized about themselves is that this whole experience of COVID, whether you were on the front lines or not, there has been an element of trauma for many people. Even quarantine. There was a very interesting study, and you might know it already, Shawn, but it looked at the brains of individuals who did not suffer a COVID infection. And it showed levels of neuroinflammation, and they looked at markers of neuroinflammation. And basically what the researchers said was that these individuals were still experiencing some type of inflammation even without being exposed, and they looked at psychological stress, quarantine, social isolation as some of the factors that mattered. So I think that even if you think that you've, and I would want people to also thrive through this experience that we've all had as a I don't know, globally, but realize that you may have suffered in some way that's not even identified. And with PTSD, I think that I can't enhance enough and emphasize the type of therapy that's important, but also food can be important. So just rethinking your diet. Cleaning up your diet a little bit. It's not perfect. You won't get there overnight, but just tweaking things. The research around blueberries, adding in blueberries to your diet could actually be helpful over time. It's a lower glycemic fruit. It's rich in fiber. It has those anthocyanins, though the antioxidants are going to be great for your gut microbes. So it's not a harmful thing you're doing if you're adding that in. These things become hugely important, along with psychosocial support, having friends, reaching out for therapy, finding individuals that you can bring into your circle to also help support what's going on for you.
Wow. So we're seeing, and we saw already early on, abnormalities taking place with our society's brains, our people in our communities that weren't necessarily contracting this virus, but something was going on, which just gets back to the point of your thoughts affect your biochemistry, right? We tend to not respect stress because it doesn't have any calories. in a way. You know what I mean? But
Yeah.
it can literally, the same as that physical thing you're putting in your body,
Yeah.
that stress that you're dieting on
Yeah.
can
Yeah.
alter your brain, literally.
It can. That's such an excellent point, because I always like to consider stress to be a vital sign, because we think about heart rate, and we talk about blood pressure and pulse all of the time. Stress is like a vital sign, because just because I can't quantify it on a speaking on a blood pressure machine or something like that, doesn't mean it's not there, but it's doing so many devastating things to the body. And I think that, if anything, I feel like the enhanced stress of everyone during COVID definitely impacted our physical and our mental health. So that's has been one of the drivers.
Yeah. So let's talk about, if you could, I would love, since you were here, to ask you what PTSD is at its core. Again,
Yeah.
with the caveat, I know that it's diverse, each person's different, but from a clinical perspective, what is it?
When I've treated individuals with a PTSD or made the diagnosis, it's really been someone who's been exposed to some kind of acute or chronic. So it may have happened a longer time ago, or it may be more acute, some type of traumatic event. And it could be bullying. Could have been someone who was bullied in school and is only coming to terms with it as an adult. Some of the symptoms that people experience are nightmares, flashbacks, feelings of anxiety, mood disorders can also be sort of those overlapping comorbid diagnoses along with just the PTSD itself. And individuals are often, fragile in the sense that it's not easy sometimes to communicate these feelings. For example, someone I was treating came in for a symptom of anxiety and wanted to look at trying to lose weight, but really from the perspective that she felt her increased weight was causing her anxiety. And so she wanted to work on dietary measures. But when I evaluate someone, I always go through a full psychiatric history. And what I uncovered was that she had been abused as a child, which she shared as part of the history, because I asked the question as part of the exam that I do. And she didn't really talk about it or go to therapy. And in some ways, when we spoke about it, a lot of emotion came through. And she ended up very tearful, very anxious in the session. And what we really realized when we worked on together was that some of what happened with her is that not really working through the trauma or acknowledging it as an adult in her therapy or early on in her life, even as a teenager when it happened, had almost led to this bubbling over of angst, anxiety, but that she really clearly, when I asked her the symptom profile and things, she actually had a lot of symptoms of PTSD, but yet presented with a very different reason that she wanted to work on it, because she hadn't uncovered that for herself. And, I think that that's just an example of sometimes something has happened to a person and they haven't realized the impact that it's had. And that's why I mentioned the example of bullying, because I encountered that a lot in different eras or different age groups of people. Just being treated badly at school, wasn't, maybe we use the word bullying, but it wasn't as recognized now as being a factor that impacts people's mental health. So
That's so profound. I think that a lot of us, I know myself, I could be like, I'm fine, and not
correct.
really,
Yeah.
because we can, and even in our minds, we can compartmentalize things and like tuck things away and not understand how they're affecting our behavior today. And so, when I mentioned this, and we talked a little bit about this, but just from the environment that I grew up in, and seeing the things that I saw, being exposed to the things I was exposed to, I had no idea that I was carrying that with me, and that was a result of how I was behaving and showing up in the world myself.
Right.
I thought they were two different things, and so I was just trying to address the behavior
Yes.
instead of addressing the root cause of it. I remember going to the corner store and coming out, and a kid had a gun in my face. And the kid was younger than me. I was probably 12, 13, 12. He's probably, a little bit younger. And, the store owner fortunately came out. He was trying to get my shoes.
My goodness.
And, he ran off. But that moment stayed with me. Obviously, it's a kind of like a traumatic thing.
Yes,
But
very much.
for me, even in that moment, the next day, I wasn't thinking about it like you think you might. I wasn't replaying it because it's just like this kind of shit happens around here.
Right.
And so
It's
but
accepted in the environment. Yeah.
Exactly. But it's not normal. It's not
not
okay.
normal, yeah.
Right. And so seeing the violence in my household and outside my door, and my tendency would be to now participate in that violence or completely isolate and hide from the violence. So I had kind of a choice to make there. So thinking about my aggressive behavior later on in life, like, fighting in school and things like that, and solving my problems that way, it was really a result, like this kind of mental disposition that I had was a result of this post-traumatic stress. My biology, I went through traumatic experiences that was showing up in how I was operating in the world. Is that correct?
That is entirely correct. And I really appreciate what you shared and the examples you shared, because it's a perfect example of someone living in that environment and the false normalizing that happens, not through any fault of yours, but because it's sort of environmental. It's kind of normal for that to happen. So you didn't think about it the next day. But when we look at the exact example, it's horrible. It's horrible for that to happen at any age, let alone a 12-year-old or even a 10-year-old, and to have such a frightening experience. Trauma happens in those overt ways, and I think acknowledging it, and this is where therapy can be hugely powerful, because the client I mentioned, Shawn, probably much like as you've uncovered these things for yourself, hadn't even thought that was something she should address. I think shame was part of it. Abuse victims often carry so much shame about what's happened to them, and it takes a process of really working through it in therapy. If they're open to it, one should never push them. And there's a whole lot of science around that. But if they feel ready or they reveal that, and in that exam with me, so much emotion came forth. And I'm guessing as you worked through this in your own life, some of those emotions would have come forth because I'm guessing your body was carrying that trauma.
Yes.
And the interesting thing is it carries it on a cellular level, right? And it carries on multiple levels that are chemical in our body. So one of the things I wanted to share is, people, you mentioned earlier about that I'm very inclusive in my view of food and nutrition. And some of that comes from my own experience growing up, because before I moved to Boston, I grew up in South Africa. I'm sort of Indian descent and East Asian and South Asian and all of that, but I actually grew up in a country that embraced apartheid. And so what many people don't realize is that there were only two colors in South Africa during apartheid. There was white and black. And I was not white. So, and I remember childhood experiences which took me, it took many years in therapy to figure out all of this, because like you, that was what was normal in my world. It was normal to not be able to do things that other kids had access to, not be able to go to a theme park or go to a certain beach, or be segregated and excluded from experiences. It was normalized because of how the culture was, and my parents did their best to protect us against that. And one of the things that I really felt so deeply about was what it felt to not be included. And it really led to how I think so deeply about food and nutrition, because I never, even though I was actually raised vegetarian, my family happens to be Hindu and they're all vegetarian. I cook anything. My husband eats anything. But part of that really stems from having been excluded from things as a child, and realizing how deeply traumatic that was, and that my response to it is I never ever want to exclude someone based on what they eat, and to find a way to work with them, their mental health, their health issues, their physical health, and to make them feel included. And that's part of the reason I don't agree with the diet wars that go on and the eat this, not that mentality, because it excludes people. And on a very deep level, I know what that's like. And I think that food is something that should be very unifying for people. It's the one thing that across many cultures you can talk about, and share.
Yeah, this is part of doing the work, like you just mentioned, where you can turn something so painful and traumatic into a gift for others. Like, first of all, the gift is to yourself first and foremost. Right. And so when you mentioned the value of therapy, just even thinking about when you said it, it just was just like, yes, it felt such a relief to talk about these things. And so I would share just a lot of these stories with my wife, and it just like felt, because I never told anybody except my family at the moment back, whatever, 30 years ago, whatever that was. But, to share that with somebody today, I didn't realize again that I was carrying it with me. Right. And to be able to voice it, to share it, to get it out of my body, I physically felt lighter. I felt more free. And also, especially to do this with somebody who has a capacity to understand or to be in non-judgment as well, which is a great onset or opportunity with a good therapist. It's just a valuable tool, because we don't often realize, again, that our behaviors today are really driven by things that could have happened 10 years ago, 20 years ago in our childhood.
That's right, experiences, and they all affect our body, and they all affect our body chemistry on a cellular level. So it's not just the gut microbes, it's how we're thinking, it's our level of stress, it's what we carry within us. And I think that, it's funny, Shawn, because when I mentioned leafy greens or salads, and I try to stay away from just rote food recommendations that everyone hears, but just try to make the nuances in nutritional psychiatry available. But I'll often get the eye roll when I mention, eat those salads, eat this, or what the recommendations are. But I often also get the eye roll around therapy, I have to tell you. And I'm a huge proponent, not only, in our program where we trained as psychiatrists to be able to do therapy. It's a powerful tool. It's a hugely powerful tool. And someone has to be ready and all of that. But it's a very big part of whether you're using food, whether you are being prescribed a medication, whether you're using exercise to feel better. All of these different components should work together, but therapy is one of them.
Yeah. And the great gift that we have today is that you can seek out a therapist who's aligned with you and your values.
Yes.
Right? So people can find folks like yourself and who understand the value of nutrition, for example, and not just wanting to, again, treat a symptom, and also providing your breadth of knowledge on helping to unpack things and to process emotions and all these other valuable entities that oftentimes, again, we just don't have the skill set personally to do it. It's not a part of our culture currently.
Right.
Yeah,
we don't. And that's why it's funny when you are studying psychiatry and you're going through residency and stuff, you're actually encouraged very strongly by your supervisors and your training directors and things to be in your own therapy, to not only experience it, but then be able to use it as a tool, because the belief and understanding, and something I actually agree with, I don't agree with everything in psychiatry, but it's something I do agree with. You, by having that experience, you can share on the power of it, but you can speak to it from a very real perspective and not just a textbook perspective.
Awesome. Well, you mentioned earlier, so I want to talk about some specific foods that we have some data on being supportive of our mental health. You mentioned blueberries earlier, the anthocyanins, really great source of antioxidants overall, the fiber. What are some other foods? Let's talk about beverages, right? Because a lot of people, I think, would be pleasantly surprised reading your book that you really are an advocate, or you really value coffee.
I do value coffee
for mental health. So let's talk about that.
So it's also a nutritional psychiatry nuance, as I like to say, because not everyone can tolerate coffee, and not everyone with anxiety can tolerate coffee. Studies have shown that consuming less than 400 milligrams a day can be okay in someone who has anxiety, but this is where body intelligence comes in. So if you have a little bit of coffee and you feel jittery and you don't feel comfortable, it's not for you. So that's super important.
Yes.
Coffee in a recent study actually was shown to help focus in adult ADHD individuals. So there are many physical benefits of coffee that have been touted over time. I find that coffee on its own is actually rich in polyphenols, and that's what the research shows. It's caffeine that can be problematic for people, and that's where one has to be a little, you have to be a little bit careful and cautious about it. The other thing that I think is the issue with coffee is what we put into our coffee.
Absolutely.
When we adding, packets of sugar or artificial sweetener, or a quarter cup of processed creamer that has the same list of unhealthy ingredients that you don't recognize.
Vegetable oil.
And vegetable oils.
Oh my gosh.
And stabilizers and food dyes and colorants, same things. When you're adding a quarter cup, let's think about a 20-ounce cup of coffee, that large size that many people do like to drink or is popular, let's say, it can have up to a quarter cup of whatever creamer is being added. And then a few years ago, my patients were coming into the office with the new fancy colorful drink that was the rage at the time. Had multiple colors, and so I tested it.
Are you talking about like the unicorn frappuccino thing from Starbucks?
The unicorn.
We call it out around here.
You call it, okay.
Yes.
So yes, it was. So I decided, you know what? Everyone's drinking it. I know. I'm looking at it and I'm thinking it's not healthy. But I thought, let me because I get pushback from my clients. It's like, well, I got the non-fat and I got this, and it's like, okay, that's fine. I'm not judging you, So I went and I ordered the smallest size with the lowest fat version, the no sugar added, no foam, no whip, whatever it is. And I did it through my app. And it had, I'm going to ask you to guess how many grams of sugar it had. The size 12, which was the smallest you could get. So no extra topping.
Okay, 12 ounces, you said, maybe?
So the size was what, 12, about 12 ounces, but what would your guess be the grams of sugar?
Maybe 20.
Okay. It had 57 grams of sugar.
57, of
grams
course.
of sugar
Of course.
in that small size. So, then I was able, after I got it on the app, I was able to then share with clients. I said, this is all I'm saying. This is what it actually contains, even without all of those other toppings and fancy ingredients or syrups and things like that. So I think it becomes important that we know what we're consuming. But when we think about healthy foods, I think the things that often people overlook are the nutrients that are beyond. We talk about antioxidants, we talk about anti-inflammatory ingredients, but just leaning into a plant-rich diet can be hugely helpful to a person. Adding in things, so you mentioned beverages, there are great other beverages to have. If you consume dairy, kefir is a fermented form of milk that is actually good for your gut. The plain version, kombucha, again, watch for the added sugars in it. Coffee, definitely, if you tolerate it, good. Worry about what you add to it. And water. One of the things that gets ignored. What I've seen individuals with dehydration present with severe anxiety. Poor hydration can also. On my Instagram some time ago, we shared on a study where dehydration was also associated with a low mood and depression. So just remaining hydrated, having that water bottle with you, having your glass of water, sipping throughout the day becomes hugely important.
Yeah. In my latest book, In Eat Smarter, I mentioned a study finding that just a mild version of dehydration shrinks the volume of the brain itself, right? And it makes, of course, it makes sense logically because the brain is mostly water. But it's not a joke. Like, we're looking for these magical things to improve our brain health and our cognition. Water. It's primary thing. And by the way, I undershot that sugar amount on purpose. But 57, that's about 14 teaspoons right there.
That's huge. Yeah.
Right? Yeah. So that is so crazy. You're getting the smallest one. None of the bells and whistles, the added accessories, and it's still that amount of sugar, and it's just like popularized right?
advertised, popularized, marketed to, as there's the new thing that everyone should be having. And yeah, so I think that's why we just need to know what we're consuming. So
Awesome, awesome. So what about tea?
yeah, so tea is one of my favorite substances. I grew up drinking a lot of tea, and I think here green tea is rich in EGCG and L-theanine. So great, I find that it's a great pick-me-up in the afternoon. So I usually drink my coffee early in the day, and then I find that if I'm having more meetings and something that I have to do in the afternoon and need a little bit of a pick-me-up, actually a cup of green tea is one of my favorite things to do. There are many teas that actually can be used even for anxiety. And sipping on these, there's good evidence behind them. So one's passion flower, lavender, chamomile. These actually have been shown. So not to be overlooked in terms of having some good benefit. Again, what you add to it becomes important, and I think it can sometimes be overlooked as a mechanism, just like breath work can be for anxiety, So I will spend time teaching a client breath work when they're not anxious. They're working with me and on a regular day, and teaching them exercises to help that when that panic hits, they have something that they can actually utilize beyond Xanax. So, rather than go to the Xanax, why not we think about how can you breathe? Can you hydrate? What did you drink that morning? Maybe you didn't realize that you had something caffeinated and you're sensitive to caffeine that could have precipitated it. So
Yeah, and you kicked it off by talking about body awareness.
yes,
Being able to pay attention to what's going on within our own system, which we're so externally focused today that we often ignore or misdiagnose our body's expressions, right? And so you're a big part of your work is getting us to be able to look within, to pay attention to what's going on with our own bodies, and to become educated on what to do.
let's educate ourselves as best we can about what to do, because it begins with that self-awareness, whether it's understanding that there might have been a trauma you experienced or whatever. It starts with self-awareness. And I think that sometimes we spend a lot of time on healing the outside body, but the inside world and our inner world is equally important. So
Awesome. So we've got blueberries on the food side. We've got a bunch of beverages we just went through. One other thing, if you could share, because we talked about the omega-3, omega-6 ratio, so we want to pay more attention to omega-3s. So where can we get some of those?
So omega-3 foods, rich foods, are things like fatty fish. So salmon is a good one. Wild-caught salmon is a good choice. There's actually a nice mnemonic for that. For the fatty fish, it's salmon, it's salmon, mackerel, anchovies, sardines, and
Herring?
and herring.
Boom,
yes,
smash.
Yes, exactly.
We smashed that together.
Right. So that's a good mnemonic to know. But not everyone's consumes seafood. And by the way, I want to mention this. So many people said, well, of course, salmon is more expensive and not everyone has access. So recently, I specifically stopped at about 2 or 3 dollar stores, and I wanted to see if any of them kept canned salmon, because here's the thing: you may not be able to get a fresh or frozen side of salmon, but you can get it canned, and it's still going to have some benefit. And almost every single store that I hit had cans of salmon. So understand that there are ways we can get brain healthy food. Not all the foods they had there were healthy. In fact, most of them were not in the dollar store, but they had canned fish and they had canned salmon. So to me, it was a note to self. And but other sources, if you, like myself, are plant-based, are seaweed, algae, nuts and seeds. So flax seeds, hemp seeds, all rich in the short chain omega-3s, which are not as well absorbed, but if you can take an algal oil supplement if you want to make up for that.
Absolutely. So I highly recommend people, if they're not doing fatty fish or fish oil, most of the studies are done using fish oil.
Most of the studies are on fish oil.
Krill oil is another option, and also, as you mentioned, at least get yourself an algae oil, at least. Because we know the omega-3s, the DHA and EPA
Yeah.
are there. We don't have many studies done yet, but we don't have to wait around because, again, this is going back. Our ancestors for thousands of years has been utilizing algae, sea veggies,
Yes.
and the like. So we can always lean on that. And I just appreciate you so much for sharing your wisdom. And could you let everybody know again about your book where they can pick up a copy?
Thank you. Thanks, Shawn. So my book is This Is Your Brain on Food. You can find it on my website at umanaidoomd.com. Please follow me, subscribe, because you'll get my weekly newsletter where I share a lot of the studies you mentioned and updates. Follow me on Instagram at Dr. Uma Naidoo and across all social media. So that's at DRUMANAIDOO. And communicate with us. We love to hear from people, and we love to get book photos when you get the book, because we share that. That's how we're building a larger community around this. And I feel very grateful for the invitation, Shawn, because it's these experiences that help people know a little bit more about the work.
Hey, if you like this video, make sure to check out this video right here.
Not only are we damaging our gut bacteria by eating horrible foods with high sugar and preservatives, emulsifiers, etc., we're also putting them in a dark place for over 24 hours where they don't know what night and day is, and they're dying off that way.